Hello, my name is Shelby Manna, and I'm going to be presenting the PowerPoint presentation on policy change for Group B. We chose me to present because I'm currently on maternity leave, which is what our project is actually about. I am 8 weeks into my maternity leave, which lasts 12 weeks. It is unpaid, and I was required to use my paid time off that I earned while working at the hospital. And once that ran out, you can use short-term disability, which I unfortunately didn't have, or it is considered unpaid. But you can take 12 weeks through FMLA, and that's what we're going to be kind of talking about in our presentation. So I'm just going to share my screen really quick. All right. Make myself a little bit bigger. Here we go. So our presentation is on maternity leave. It is by myself, Shelby Manna, Charis Nunes, Tina Pagan, and Joseph Blackstone. Maternity leave and its impact. The birth of a child is a time of both joy and pain. During the last trimester through the first year of birth, many women have found it necessary to leave their places of employment in order to care for their offspring as well as for their recovery. The unfortunate fact is that many women are forced to limit the duration of their maternity leave due to financial concerns. The maternity leave dilemma was aptly evaluated by Christopher Ingram of the Washington Post in his statement, "The world's richest countries guarantee mothers more than a year of paid maternity leave. The U.S. guarantees them nothing." The U.S. is the only first world country which does not mandate employers offer paid leave for new mothers. More about the impact of unpaid maternity leave. The lack of paid leave forces many mothers to return to work prematurely in order to pay bills. At first, my husband and I thought that this was what we were going to have to do at 6 weeks, but we were blessed with him getting a second job. So we have been able to keep me out the full 12 weeks, thank God. But I know that's not the case for every family. The lack of paid leave inhibits the mother from creating a bond with their newborn. I cannot imagine being separated at 6 weeks. At this point, the newborn is still not sleeping through the night, at least in my case. And I still hardly know this child. Definitely taking it day by day, and still a lot to learn and a lot to bond. The early return to work also is detrimental to the mother's mental health, since many mothers felt postpartum depression. Haven't developed that yet, but I definitely did have somewhat of the blues, as well as just stress overload, just trying to learn how to do everything. So I can't imagine school, the baby, and work after 6 weeks. Just nuts to think about. 12 weeks already seems like not enough. The lack of paid maternity leave has an adverse financial effect on the family as well as the mother. So what do other countries offer besides the US? So right now that there's about 21 countries that offer a full year of paid maternity leave. Of those 21 countries, Japan has been implementing their policy since 1995. Russia gives women about 5 months of paid maternity leave at 100% of their salary. South Korea, Japan, the Czech Republic, Austria, Denmark, they all offer this year-long paid maternity leave. And in Finland, mothers are allowed up to 3 years of paid leave. One can only wonder why a country so wealthy would seemingly attempt to punish those who want children. The U.S. policy seems counterproductive. So what's the impact on mom's mental health? Studies indicate that short maternity leave is detrimental to the child's health, both physiologically and mentally. The newborn arrives in the most vulnerable of states, where the newborn is at the mercy of the adult to protect and nourish it until a certain age of some independence. Generally, the first year of the child's life are dependent on a mother's presence. So in a study published in the Journal of Mental Health, Policy and Economics found that mothers who had returned to work after 12 weeks or less of maternity leave and less than 8 weeks of paid leave were found to have increasing levels of symptoms of depression as well as diminished health. One of the biggest symptoms or indicators of deteriorating mental health in these mothers is depression. Depression can affect the life of a person in many ways, such as the quality of life, impaired social functioning, and increased risk of health problems. So not only does the amount of maternity leave have an effect on the mental health of a mother immediately surrounding the birth, it can also bring on depression later in life. This was shown through a research study analyzing the long-term effect of maternity leave on the mental health of women. Quote, future leave policy debates should consider maternal health implications. The finding that taking additional leave days up to 6 months after childbirth may help decrease postpartum depressive symptoms provides a specific leave duration that proponents of longer leave durations can present in the future testimonies on leave policies. We need to catch up with the rest of the world in regard to this, where women in the US should not have to feel stressed about having children because her job is at risk or because she'll not be paid for doing what's natural to be a mom. So summarizing the policy that affects this issue of maternity leave, conditional maternity leave that we have currently is provided under the Family and Medical Leave Act, or also known as FMLA. Under this act, eligible employees of covered employers are entitled to take unpaid job protective leave for specified family and medical reasons. Only eligible employees are entitled to take FMLA leave. So in order to be considered eligible, the employee is one who either works for a covered employer, has worked for the employer for at least 12 months, does not have to be at a consecutive time, but a total of 12 months, has at least 1,250 hours of service for the employer during that 12-month period immediately preceding the leave, and works at a location where the employer has at least 50 employees within 75 miles. Eligible employees may take up to 12 work weeks of leave in a 12-month period for the birth of a son or daughter or placement of a son or daughter with the employee for adoption or foster care, to care for a spouse if someone gets sick, serious health conditions that affect the actual employee, or for any qualifying existing arising out of the fact that a spouse, son, daughter, or parent is a military member on covered active duty or call to covered active duty status. So our proposed policy change is implementing a 12-week paid parental leave. There are some alternatives. There are some alternatives. Basically, not doing this. Basically, the outcome will remain the same, which is parents with stress and concerns over financial obligations. And not only does this affect the individuals on a personal level, it also may have effects on work performance. So implementing the policy change of 12-week paid parental leave would have a positive outcome. Mothers would return to work with a positive outlook and feeling confident. The financial burden would decrease and the parents wouldn't feel the need to cut down the bonding time with their child to return to work. Implementing this change also helps with sharing responsibilities between parents. A new baby is not just a woman's responsibility, it is a shared one. It's very important to move this change because it benefits both parents, the child, and even the place of employment. So some advantages. It has shown to increase employee morale. Paid leave worldwide has reportedly been linked to higher birth weights, lower infant mortality, greater engagement for fathers, and overall improved health of the child. It increases productivity. Financial stress can affect work performance. Many may seek quick money loans or rely on credit cards to make ends meet while on unpaid leave. Without this financial burden, employees return to work with a sense of readiness. Increase of women in the workforce. Women with access to paid leave are significantly more likely to return to the work, are able to build more tenure, maintain good job matches, which can raise their earnings and help close the pay gap. And equality, it promotes gender equality. Some disadvantages would definitely be cost, which we'll talk about a little bit more in depth soon. To accommodate for the time the employee is on leave is significant. Therefore, companies must absorb the expense and may even become an economic burden. Not only is money being spent on paying for the employee, but additional money is spent on hiring and training the employee that is temporarily replacing them. and also chances of discrimination, talking about equality and stuff. The chances of being discriminated against may increase based on gender. The employer may be more inclined to hire male workers to avoid the possible extra expense. Maternity leave costs and feasibility. Currently, only 11% of workers receive paid leave for maternity. Some other statistics, only 3 states offer guaranteed paid leave. This is California, New Jersey, and Rhode Island, funded by employees' payroll deductions. In New Jersey, 6 weeks of paid leave is 100% paid for by payroll deductions. Each employee pays 0.09% of taxable wage of the first $32,000 in wages earned. Employees can take up to 2/3 of their average weekly wage, up to $595. Cost continued. In California, workers can receive up to 6 weeks of paid leave. Workers are paid 55% of their average weekly wages, up to $1,067 per week. The program is fully funded by employees paying into the fund with an average cost of $30 a year per employee. Using California as our example on how to determine the cost for the United States to implement 12 weeks paid maternity leave, we need to multiply $60 times the working population of the United States, which is roughly $126 million. This would make $3.78 billion available to fund the program. The $30 that California uses as the cost per worker is based on 6 weeks paid leave, but it is also available to men as well, so the cost may be higher. The problem is that it's hard to factor in how many men actually use the program due to bias. Many men feel that they might lose their position if they take the full 6 weeks due to some stigma and competition. Costs continued. The true cost of the program cannot be determined until after several years of implementation due to lack of data to determine how many women will actually use the program. According to Zagorski 2017, the number of women taking maternity leave in the United States has not changed since 1994. Unfortunately, Zagorski was unable to determine the reason for this stagnation. Even with 3 states providing time off, the number has not increased. Zagorski theorized that one of the reasons is that most women do not get paid leave. So if there was a national program, it's likely that the numbers of women taking this leave would increase. Zagorski concluded that most women that take maternity leave are educated and financially secure. Only 47.8% of women who did take maternity leave were compensated. This number on average has only increased 0.26% per year since 1994. This stagnation of women taking maternity leave is surprising since the United States has seen large gains of economic growth from 1994 to 2015. Only 4 countries out of 173 lack paid leave for women after childbirth. Future costs will be difficult to determine due to unknowns: inflation, population size, birth rate. As of now, the inflation rate is 2%. Birth rate 18.6 per 1,000 people, and the population is growing at 0.71% per year. So evaluating this policy after implementation. After implementing the policy of 12 weeks paid maternity leave, the government should keep track of how many mothers opted to utilize the policy. The data should be compiled early for tracking purposes, and the government should publicize the new policy to make sure all citizens are aware of the new policy. According to many residents of California are unaware of the 6 weeks paid leave, especially the poorer residents. So evaluating the policy continued. Studies should be done to evaluate how paid maternity leave affects infant mortality. According to Impacts 2018, studies have shown that an extra week of maternity leave has reduced infant mortality by 0.5 deaths per 1,000. Studies have also shown that women who take longer maternity leave breastfeed their children longer. Babies that are breastfed are less likely to get infections, have lower risk of obesity, decrease infant death, and reduce asthma rates. Breastfeeding has been shown to produce substantial health improvements in immune system development and disease prevention. Based on these research findings, positive effects from the implementation of maternity leave is expected. To reiterate what we should see: reductions in infant mortality, lower rates of asthma and obesity, higher rates of breastfeeding should also be seen. Other positive effects that will be harder to evaluate are mother-child bonding time, stress levels of women, talking about the mental health, baby's sense of security and overall happiness due to longer bonding times, and depression levels. Many women battle depression after going back to work due to added job stress and maternal guilt. Evaluating the policy continued. Some economists argue that more women have come back to the workforce since California implemented the policy. According to Impacts Again, the pay gap between mothers and non-mothers should equalize if there is a national policy. Employers will not penalize mothers for taking maternity leave, and concerns of not returning to the workforce after childbirth will be reduced. So policy supporters, who will be the policy supporters for this 12-week paid leave? The working women and their families, and those who plan to have a family in the future. Working women who would like to have a family in the future. Fathers that are supporting and also want to take paternity leave, and couples who adopt or foster an infant. Same-sex couples desiring maternity leave. Policy supporters and recruitment. Corporations need to be recruited to support proposed changes. Many corporations have lobbied against a 12-week maternity leave for the fear of cost and productivity loss. Educate corporations that employers in California have shown a reduction in costs due to lower turnover rates and other costs. Google reported that turnover rates by women had fallen 50% since implementation of an 18-week paid maternity leave. Politicians need to be recruited to help support the policy, and 15% of people not paid for maternity leave turned to public assistance. Recruitment continued. Research studies have shown higher IQ, education, and income levels for those whose mothers use maternity leave. The greatest effect was seen in children from lower educated families. As President Barack Obama said, family leave, childcare, flexibility, these aren't frills, they're basic needs. They shouldn't be bonuses, they should be the bottom line. So in summary, the current conditional maternity leave via FMLA has resulted in negative consequences for maternal mental health, decreased vital bonding time with the infant, and can create major financial concern for a family. The proposed 12-week paid maternity leave would benefit not only mothers and fathers, but consequently the newborn. Although some disadvantages such as cost exist, many benefits are apparent as well that combat the negative consequences discussed above. Longer leave has statistically shown benefits including reduction in mortality, increased length of breastfeeding, etc. Policy supporters would consist of mothers, fathers, extended family members, couples wishing to adopt, and even supportive healthcare staff, such as myself and my group members. These are our references. Thank you.